I'm Jeremy Wyatt. I'm Professor of Digital Healthcare and Director of the Wessex Institute in Southampton, and I'm also an advisor on new technologies to the College of Physicians in London.
So what do you think the key challenges are at the moment in the space of health informatics?
Well, I think the first big challenge is to assert our identity and emphasize that we're interested in interactive systems that help clinicians, doctors, nurses, other health professionals, patients and the public to better manage information so they can make better decisions and change their behaviour appropriately. Unfortunately, at the moment, if you use the phrase health informatics to many people around the health system and the academic sector, they tend to think it's all about big health data and data analytics. And that, of course, is part of what we do, but it's only a very small part. So I think that's the first big challenge, is to re-identify ourselves as being about improving information flows, communication and decision making in the health sector.
So what do you think organisations like BCS, for example, can do to help you guys?
Well, one possibility would be to rebrand the health informatics grouping in BCS as being about clinical informatics or digital healthcare. There's a number of phrases, even e-health is another potential identity. I also think it's really important that we stay connected between the practitioners and the academics, the people doing research. So anything that the BCS can do to help bring about better contact between academics and practitioners is great. And I think that both sectors really have got a lot to do, and the BCS could be a really useful forum to facilitate that.
And do you think, for want of a better term, health informatics is a good place to work in at the moment? Are we in a good space?
I think it's very exciting indeed. 15, 20 years ago, there were really only a handful of us working in this space, and very few people who, like me, were lapsed physicians and actually understood how clinical decision making, hospital environments, etc. work. So I think that now we've got so many people being appointed as CCIOs or training as CCIOs, and I think the more we can do to engage those people with what the research, the academic side is generating, and also to feed their questions back to researchers, because it's very important that researchers focus on questions that matter rather than on questions that they think matter, and there may be a difference.
And where do you think the UK is in regards to other countries? Are we leading the way, or we keep holding our own with health informatics?
I think with the CCIO network, that's a really important development over the last 5 years. And we also have, for example, the WACTA review happening at the moment. We're really looking forward to hearing the results of that. I think that's potential for engaging many more clinicians in the area in an informed and constructive debate about where we want to go, what are the key issues, how to get there. Compared to the States, for example, there are far fewer clinicians involved in the UK. The clinicians in the US have they're really quite a powerful force for change. They also support the research, the evidence-based health informatics, if you like to call it that, movement. So I think it is important to get more clinicians involved. It's also important, of course, that engineers, and the BCS represents engineers, are involved. But I think I've seen so many projects that have been technology-led in the past, and I think it's very important that when we do research projects and practical implementation projects in health or clinical informatics, that they're focusing on specific problems that matter to the health system. So questions around safety, quality of care, efficiency, affordability, and spreading out knowledge and data to patients and the public as well. We've got 17 million people in this country with long-term conditions, and they need a lot of support for self-management, for example.
And if you were to give one piece of advice to someone who is thinking of moving into the health informatics industry, what do you think it would be?
This isn't a new area. People have been working in the area for about 40 years at least. There's a great deal of knowledge and people working in the discipline already, a lot of experience and a lot of literature, a lot of evidence out there, but it's at the moment quite hard to put together. And one of the things that we'll be talking about this afternoon is how we can assist that knowledge transfer process. So that might be another role for BCS.
I didn't know if you had any thoughts about what is going to be happening at HC if you wanted to share your thoughts about that.
Yes, HC has traditionally been a conference for industry and the NHS, for practitioners and suppliers, and the occasional researcher or academic does participate. And I'd like to see more engagement from researchers and academics, and I would say that because I am one, but equally I think that it's kind of triangular relationship. You can't get things done without industry, or without the pull from the NHS, from clinicians. But equally, you don't want to be doing the wrong thing, and that's where academics, people who can do evaluation and research, can help you make sure that you're headed in the right direction. So that's the evidence-based approach.